All right, so then
Yeah.
you've had a little more
Yeah.
of a lengthy experience than we've had, I guess, with some of these restrictions and changes in your daily lifestyle. So, I mean, obviously, I'm sure you know here we've been social distancing. We've had a lot of our major businesses closing their doors. We don't go to restaurants or bars anymore. We get takeout and we stand 6 feet apart at the grocery store. Last week, we all started putting on cloth masks when we go out into public to try to protect ourselves and others from the spread of the virus. So those are some of the precautions we're taking. Maybe tell us a little bit about what your experience has been like in terms of what your government has required and what people are doing.
Okay. Well, Korea, it's they know everybody's cell phone numbers, and it's kind of like a message you'd get like an Amber Alert. But starting starting in February, early February, they started messaging us over our cell phones, asking people to reduce their trips, into public. They tried to get us to stop going to restaurants, and stop going to bars, and they would send messages about washing your hands and wearing a mask and social distancing. But they weren't shutting down the bars. They weren't shutting down the restaurants.
Mm-hmm.
They were just asking people to, be safe and go home and social distance. So we stopped eating out. The last restaurant we went to was mid-February, and that was once. But really, that's the only time since the new year that we've been, since we got back from Laos, that we've eaten at a restaurant. It was one time. But we just, once we realized how contagious it was, we just stopped even ordering takeout, because the fewer hands that touch my food, the safer I feel.
Right.
But yeah, so the difference between the way Korea has handled it and the way America has handled it is that first time the school closed because they had a patient that they confirmed had coronavirus, and they
Mm-hmm.
did contact tracing, and they figured out everywhere this person had been, and that included our local mall.
Mm-hmm.
And they sent out text messages and said, if anyone has been to this mall on this day during these hours, go home and self-quarantine. And then they shut down the mall and they completely disinfected it, and it was open again in 3 days. They don't shut things down permanently like a lockdown. They shut it down to clean it. They tell everyone who's been there, go home and self-quarantine. And then life goes on 3 days later when they've finished cleaning it.
Wow.
So it's because they're testing so much, and they invented the drive-through testing, which I think you have there now. But they haven't restricted who can be tested. If you get in your car and you drive through right now, you can get tested,
Wow.
and they don't charge you anything. All your treatments are free. They don't check to see if you have insurance. They don't check to see if you're even a registered resident. So we have resident cards, alien registration cards is what they're called.
Mm-hmm.
And that allows us to have the national health care, but they don't check. They don't care, because they're much more concerned that everyone who wants to get tested can get tested, and everyone who needs to get tested will get tested, and they don't care what your nationality is or whether or not you pay into the system
Right.
or if you're documented. They just want to contain this thing.